7 early signs of respiratory syncytial virus, RSV, in adults. Did you know that respiratory syncytial virus, also known as RSV, isn't just a childhood infection? In adults, especially those over 60, RSV can lead to dangerous complications like pneumonia, severe breathing problems, and hospitalization. The scary part: most adults mistake RSV for a simple cold until the symptoms become much worse. So in today's video, we're breaking down 7 early signs of RSV in adults that you should never ignore. These signs may seem small at first, but recognizing them early can protect your lungs, your health, and your life. Section 1. What is RSV? RSV is a highly contagious virus that affects the lungs and breathing passages. Most people think children are the only ones at risk. But the truth is, adults over 60, people with asthma, people with COPD, individuals with diabetes, anyone with a weak immune system are at much higher risk of severe RSV infections. And because the symptoms start mild, like a cold, many people miss the early warning signs. Let's break those down right now. The 7 early signs of RSV in adults. 1. Persistent cough. One of the earliest signs of RSV in adults is a persistent cough that gradually gets worse. At first, it may feel like a typical dry cough, but as the virus spreads deeper into the lungs, the cough becomes more frequent, more intense, harder to control, sometimes producing mucus. Why does this happen? RSV causes inflammation and swelling in the airways, making them narrow and irritated. If you've had a cough for more than a few days, especially one that gets worse rather than better, RSV could be the cause. 2. Low-grade fever. Unlike the high fever seen in flu or bacterial infections, RSV usually begins with a low-grade fever around 37.5 to 38 degrees Celsius, 99.5 to 100.4 degrees Fahrenheit. This mild fever is easy to dismiss, but it's a sign your immune system is fighting a viral attack. For adults, especially seniors, even a low fever that lingers for several days should not be ignored, because it often appears before other severe respiratory symptoms begin. 3. Wheezing or tightness in the chest. Wheezing is a major red flag for RSV. This happens when the virus causes swelling in the lower airways. As air struggles to pass through, you may notice a whistling sound when breathing, tightness or pressure in the chest, difficulty taking full breaths, a feeling of air hunger. For adults with asthma or COPD, RSV can trigger serious flare-ups. If breathing suddenly feels heavier or noisier than usual, seek medical attention quickly. 4. Shortness of breath. Shortness of breath is one of the most concerning early signs of RSV in adults. You may feel breathless when walking, climbing stairs, talking, or even resting. Shortness of breath happens because RSV reduces oxygen flow to the lungs. This symptom is especially dangerous for seniors because it can rapidly progress to pneumonia. If breathing becomes difficult or you feel you can't get enough air, do not wait. Call a doctor immediately. 5. Excessive fatigue and weakness. RSV doesn't just affect the lungs, it affects your whole body. Many adults notice they feel unusually tired, weak, slow, unable to carry out daily tasks, sleepy even after resting. This happens because your body is using extra energy to fight inflammation and maintain breathing. If fatigue comes suddenly or feels worse than normal and appears with other symptoms on this list, it may be RSV, not just exhaustion. 6. Runny or stuffy nose. That gets worse. A runny or congested nose is one of the earliest symptoms of RSV, but unlike a simple cold, it tends to last longer, become thicker or cloudy, lead to sinus pressure, make breathing harder. Adults sometimes ignore nasal symptoms because they seem minor. But with RSV, congestion often worsens over time and spreads to the chest. If you noticed congestion that continues for more than 4 to 5 days, don't dismiss it. 7. Trouble sleeping due to breathing issues. One unique sign of RSV is that symptoms worsen at night. Why? When you lie down, mucus shifts and airway swelling increases, making breathing more difficult. Adults with RSV often report waking up gasping for air, coughing fits during the night, difficulty sleeping due to congestion, chest tightness when lying flat. If nighttime breathing becomes uncomfortable or interrupts sleep frequently, RSV may be the cause. When should you seek emergency help? Some symptoms are dangerous and require urgent medical attention. Go to the hospital if you experience severe shortness of breath, blue lips or fingertips, high or persistent fever, rapid breathing, chest pain, confusion or dizziness.
I'm feeling
For seniors,
so much better
RSV
and
can
more
progress
hopeful
fast.
about my
Never
health.
wait.